Okay, so we had our sonogram and everything looks great. There's only one baby. Everything was measuring exactly as it should. They said that they saw everything that is supposed to be there, and everything looks like it's healthy and progressing exactly as it should. So my next step would be to come back for another appointment. They drew blood this time, so for anybody who hasn't had a previous pregnancy, kind of the process at your first appointment is, you may or may not have a sonogram. They'll draw blood. They do like a full panel. They look for a lot of different things with that initial blood draw. And then after that, you don't come back for another month. So our next appointment is not until November 5th. So again, this is October 1st. We'll come back in November. I don't think they'll do another sonogram at that time. They will do another blood draw, and they take urine basically every single time. I think they're mostly looking for urinary tract infections and like protein in your urine. So at the next appointment, we'll get our NIPT test done. And so this is a screening test that will look for abnormalities like Down syndrome. And for some people that's kind of a controversial test. But knowledge is power. So in our case, I don't know that it would make any difference. But some people would, make other plans with their pregnancy. But that test is really just a screening. It's not definitive. So a lot of times what they do is they do that, and then that gives you kind of the probability of whether or not you have those genetic abnormalities. And then if that's a high probability, they send you on for additional testing. So my understanding is that the next step would be, another sonogram, and then they would also do an amniocentesis. And I think the amnio is where they confirm those results. So for some couples, that's the decision to terminate the pregnancy. And for others, it's just the knowledge piece, understanding what they're looking at as they continue their pregnancy. It helps them manage risk factors with different, types of genetic or chromosomal disorders like Down syndrome, and what that looks like for the rest of their pregnancy, and then of course after birth. So in my case, I plan to get the test done, but again, I think it's more just knowledge. I am 37, so once you reach 35, they consider you to be advanced maternal age, and generally your risk factors for chromosomal abnormalities increase after 35, but they don't really start to tick up until you get over age 40 is what I understand. But again, I think in our case it probably wouldn't make a difference. So I'm really excited. There's only one baby in there. For some reason, I had it in my head that we were going to see two. Maybe I just need to stop looking at all the baby boards and worrying so much about what people are saying about, what my HCG levels were, because it started at like 26 and then they retested a few days later and it was like 236. And I think it was 4 days later. So I think that tripled or something like that when it's supposed to double in 48 hours. But again, they didn't test it every 48. They tested it 4 days later. So who knows? But yeah, everything looks healthy and perfect. So very excited about that. And again, this was not a planned pregnancy. This was something that our family is going to have to adjust to. So I think I've finally gotten over some of the initial shock. And now I'm generally just really happy. I think having a sonogram this early helps provide a little bit of reassurance. So for those of you who aren't given the option to have an early sonogram and you're very anxious about what is happening, just ask your doctor's office and see if they would be willing to do an early ultrasound. Another thing that it can do is it can help provide dating. It's a dating scan when you do it you know, around 6 or 7 weeks. And so they'll be able to tell, you know, based on your last menstrual period, is the size of the embryo appropriate for what you think it is. And as long as it's within about a week of what you think it is, they'll keep your due date the same. When it starts to get past that week, I think that's when they start looking at other things. So mine, it looked perfectly normal. In fact, on the screen, it looked like it might have been a couple days different, but not massively different. So super happy about that. Really looking forward to kind of getting through this first trimester. I've been pretty sick feeling. I've had lots and lots of nausea. Been super tired. I came into this pregnancy feeling healthier than I've ever really felt in a long time. I had been exercising a lot, and I had been just being a lot healthier, but that's been difficult to maintain given everything. So see you soon.